Raewyn Teirney is one of the world's leading fertility specialists and gynecologists, and she spent the past 20 years helping thousands of people to conceive. She's also recently made her TV debut on Channel 9's Big Miracle series. Dr. Teirney's focus is on fertility issues affecting women living with polycystic ovarian syndrome, which is PCOS, endometriosis and fibroids, and has published extensively on PCOS and lectured and trained many subspecialists on the subject. Dr. Teirney is the founder of the conceiveplease fertility app, the world's first fertility tracking app that uses the same tracking techniques used in medical fertility clinics. Welcome, Raewyn.
Hi, thank you, Lindy. It was
lovely to have you with us. You know, it's an extraordinary thing that you do, as I was saying before, and I think you know, our audience, we have a large audience in that 35 to 40 age group, you know, which is obviously sometimes that you get to the point, you know, you've been too busy, you get to this point, and of course, then you realize that you can't fall pregnant. Yes. So what are some of the reasons people struggle, the group struggles to fall pregnant?
Yeah, look, there are many reasons. You can still break it down, though. That's 50-50 is male and female reasons. So half the time it actually is the male.
Right.
So don't forget that, because women always think it's their fault, you know, when they're not falling pregnant. But half is actually male factor, fertility with low sperm numbers and all that. But for women, there are many reasons. One is obviously age. So, you know, as we age, you know, it can become harder to get pregnant. But more often it's things like women not ovulating frequently, like polycystic ovarian syndrome. It could be some tubal problems like blocked tubes from past history of maybe chlamydia or gonorrhea. And some women have a history of what we call endometriosis. Mm. This is a condition that can affect fertility and also cause women pain. So these are the more common sort of factors that can make it harder to become pregnant.
Endometriosis seems to be prolific, so it's yeah. Okay, so there is a wide range, but very interesting point you make about the 50-50 scenario, right? So yes. All right, so how can they improve their chances of getting pregnant if we're talking about the female struggling?
Yeah, well, I mean, I get asked this question all the time, you know, Raewyn, how can I improve my chances of falling pregnant?
I bet.
In fact, there are
Holy Grail.
Yeah, but, you know, there are some actual tweaks that you can do to your lifestyle that actually will help, and they've proven that. So even things like having a healthy body mass index or healthy weight actually does help improve the chances of implantation. Stopping smoking or vaping as well. So if you are smoking, that will affect women's eggs and the quality of their eggs. Right. And our eggs are dying all the time, Lindy. So if you're smoking, they'll be dying quicker. So stopping smoking, reducing alcohol down as well. You can still have that glass, that's fine, but reducing down. And eating the Mediterranean diet has been shown to help eggs and sperm. So
really?
Yes, so things like seafood, you know, tuna and salmon, that oily fish for the omega-3, olive oils, nuts, legumes, lentils, leafy green veggies, fruit. All that actually does help with fertility, but these are just simple tweaks.
Yeah. And, you know, I think, sorry, the thing is that often these are the things that help support any additional health challenges one might have, isn't it? I think we're getting better, I think, but we've
but yes, I think women and men too forget that, you know, actually this can make a huge difference to, you know, they get pregnant or not sometimes, even if they have to do IVF, even doing those little techniques and lifestyle changes can help an embryo to implant an IVF. But
so it's also as important for men, right, to look after their health? Yeah.
Actually, you know, even more so, because men, and I say this to all my couples, men are factories and women are warehouses.
Yeah.
Okay, men produce sperm every day like a factory. They just churn it out.
Yeah.
And so they're actually more prone to lifestyle habits. So if they, if they smoke, it'll affect their sperm massively. If they get the flu or get COVID, it'll affect their sperm. massively. So they really need to look after themselves, because it will be reflected in their sperm test and their sperm count and how they swim. And for women, I mean, it's more hidden because, you know, our eggs are tucked inside our ovaries and we just can't see them.
Yeah.
But it does have an effect as well. But our eggs, we're warehouses. We've got our eggs since we were born, and they grow old with us. And
Yeah.
they increase in number as well.
Yeah.
So anything that you can do that will kind of just help your eggs. So this is things like getting out into a little bit of sun. Vitamin D is really good for women's eggs and men's sperm. As I said, omega-3. And when in terms of increasing your chances, one of the biggest things is actually tracking your cycle, knowing exactly your fertile day, because women, we only have a certain few days to get pregnant. All right.
Yeah. And if we miss that window.
Correct. And not only that, once we ovulate, so the whole idea is that we want sperm and egg meeting in our fallopian tubes and binding and creating an embryo. But once our egg is ovulated, it only lasts for 12 hours.
Right.
So if it's not fertilized within that 12-hour period, it will go off and die. So,
right. So we really do have a short period of time, a short window. Yeah. So, okay, then. So at what point then, given that we have a short window, at what point then should we be asking for fertility help?
Yeah, good question. Usually if you're under the age of 35, we say, to women, look, keep trying for a maximum of 12 months.
Yeah.
And if you're not pregnant by 12 months, because you should have had an 80% chance of being pregnant by then go and seek help, and let's have a look and do some fertility tests and make sure that, your egg numbers are fine. Make sure there's no endometriosis or blocked tubes, and let's check your partner, by the way. But if you're over 35, we usually say, look, don't wait too long, because women over 35, especially after 38, our fertility drops significantly, and we have a shorter window time to get pregnant. And so maybe try for about 6 months, but no more, and then perhaps seek help or seek some advice around what to do next. Yeah.
Okay, well, that's good advice. So tell me then, at what point, what are some of the treatments and tools available to them, including your conceivePlease fertility app? And how does that help?
Yeah, there's a lot of tools around actually to help couples conceive. The simplest way is to track your cycle. That's the first thing. And cycle tracking, monitoring when your fertile days are. So the whole toolkit, that would be the simplest.
Yeah.
You can go and buy ovulation sticks, pee on them, and it will give you an idea beforehand that you're going to ovulate within the next 36 hours. And tracking apps are also very good. The tracking app, I've developed a tracking app to be launched soon called conceivePlease. And that is aimed at helping women exactly track when their most fertile days are. And we even notify them, hey, in 2 days' time, you're going to be ovulating, time to have sex. Or, tomorrow we want you to check your urine for your LH surge. So we actually notify women when they have to do all this testing. It's exactly what we do in our fertility clinics. But that's just one simple method to help women. Women who may not be ovulating, there are very simple tablets that we can give them to help them ovulate. And so called Clomid and letrozole. If there is any issues such as blocked fallopian tubes or quite severe endometriosis, sometimes it might be surgery that might help. And sometimes we may need to go and do IVF, where we're actually taking eggs out of women, getting the man's sperm and creating embryos in the laboratory to speed up those chances of getting pregnant. So it really depends on the woman's needs and the couple's needs at the time.
Yeah. Wow, that's an incredible app, and it's the first of its kind.
Well, it is for what I'm doing, which is actually, it's the first time it's done with the algorithm by a fertility specialist, not just by some technician.
Wow, what a wonderful tool.
So
That's
keep your eyes out, ladies, for the launch soon.
Absolutely. Well, that is exciting. All right. Now, I was going to say something before about mental health support, but, this is obviously a huge undertaking, and I've had friends who have been through it who have been unsuccessful. And, it's a huge drain, not only financially, but psychologically. So are there any, is there any mental health support available to them?
Yeah, it's a really good question. It's a real emotional roller coaster. Doing fertility treatment, or even just having fertility issues, because you're thinking, what's wrong with me? Or, maybe I'll never be a mother or father. And, it brings up all those issues and grief as well. The sort of support that's around, here at IVF Australia, where I work, we actually have counsellors, and all our patients get free counselling all the time.
Yeah.
In terms of just out in the general population, though, to be honest, I don't think there is a lot of support, which is really disappointing. It is. I mean, our app is going to have a lot of support for that. It's going to be having a lot more information, I think, for couples with fertility issues, or who might be struggling a bit or having to do treatment. Make sure that you've got a good team of support around you, like your friends. Let people know, let your girlfriends know, let your mother know, so that they can help nurture you.
Yeah.
And be kind to yourself. You've got to be kind to yourself, and do nice things. I tell all my ladies to go and buy a lipstick, go and get a pedicure or a manicure. You've got to do things that are going to nurture and be kind to yourself.
Yeah, that's right.
But to be honest, Lindy, there's not a lot out there just in the general public.
No, well, we generally have a fairly a massive shortage in any kind of mental health support across the board, I think. But it's a tricky one, isn't it? Because it's not just grief. It's not just, it's managing these emotions as you go through this. And this could go on for years, right?
It can go on for years. There's a lot of, long-term grief and anxiety around this. And we do know there's been some really good studies that have proven that even just meditation, like relaxation meditations, and do help with all of that grief and struggle around, fertility feelings as well. And at the Conceiveplease app, we've actually got meditations to download and for women and men to use as well, because, I mean, trying to just sort of get yourself present.
Yeah, absolutely. And it reduces that level of anxiety and stress. Ultimately, obviously, stress is not a good thing to be suffering if you're trying to conceive.
That's right.
It's trying to manage that too, isn't it?
But in our fertility clinics, we do have counsellors that all put in strategies to help our women and men in coping and what to do and mechanisms around all of that. Which is all free. But
okay. Well, that is really good to know. So then what other resources do they need? What other resources does a couple or whoever need when they're considering IVF?
Yeah, well, I think for fertility in general, people just need, go and have a look. There are resources around, even going onto my website, draewynteirney.com, and our website, conceivePlease.com. There's a lot of resources there that they can read on fertility treatments, struggling with fertility, coping mechanisms as well, diet related to fertility. There's also another really good website, Lindy, called yourfertility.org.au.
Right.
And that is set up by the Fertility Society of Australia.
Okay.
And that has some very good information for couples to go and look at, with all the up-to-date, information as well. Yeah,
because you obviously want to do that research before you even go down that path. So now, did you say or did I see somewhere that you have these Q&A sessions?
Yes, we'll be going to be setting up Q&A sessions on Facebook.
Yeah, good.
So that will be on the Dr. Raewyn Teirney and the Conceiveplease So
Right. Okay. Well, I'll let everybody know. Now, this is, of course, the $1 million question. What is the average success rate of IVF here in Australia?
yeah, well, it's actually one of the best success rates in the world.
Wow.
IVF in Australia really was a pioneer, I think, in all of the IVF around the world. So success rates are exceptional. And the envy of the rest of the world. It's still age dependent. So the chance of getting pregnant in Australia with IVF is still down to the age of the female egg.
Yeah.
So if you're under 35, chance of getting pregnant with each embryo would be about 40 to up to 45%.
Right.
Once we age and get a bit older, it can drop. And so from 35 to about 38, you'll be looking at about 35% per embryo,
Right.
and then after 38 it drops even further, and you're probably looking down from 30% per embryo down to about 10% per embryo.
Yeah.
So as we age, women over the age of 40, it does become harder.
Yeah. I mean,
even
that's
with IVF.
Yeah. I guess, nothing's perfect, but
No.
it is certainly extraordinary. And, we are so fortunate here in Australia to have you and to have all of you who focus on IVF and in helping people get pregnant. So I want to thank you. Good luck with the Conceive Please app.
Yes, thank you, Lindy.
Thanks so much for joining us.
Thank you. And thank you for having me on today, and all the best for all your people that are watching and part of your hub.
Thank you. Thanks,
Okay.
Raewyn. I appreciate